Oh, yay! Success.
Yes.
Wonderful. Hi, Suzanne.
Hi. I was
I,
I was a couple minutes late. I'm sorry. I brought my friends.
no, you're fine. And I'm usually like a minute or sometimes too early because I don't want there to be problems on my end where I'm late, right?
Got
So
it.
it's good. I'm so happy that we connected and that you carved out time because I know you're a busy woman and you have an empire to run.
It's a little bit around here, but this part is very important. So I'm really glad to be here.
Good. Thank you. Thank you. Okay. So this is our first time meeting. We've talked a little bit on Instagram, but I'd love to hear more about you and your story. And we just have a lot of questions. So if you can just start there.
Yeah, so I'm a women's health physical therapist. I started doing physical therapy in 2000, so a while ago, and I quickly discovered that there was this new track of women's health, and worked for a company. I was really fortunate that put me on that track after they saw that I was interested, and I was just able to take a whole bunch of coursework around pelvic floor rehab, and that kind of led into Pilates-based rehab and how those two worlds were kind of merging at that time. And I just loved it, and I kind of immersed myself in it. I took every course that I could get my hands on, and it just kind of became a specialty area. Not too many people were in that specialty area at the time, so I quickly realized, hey, I have this toolbox and I see all these women that need these tools, and it just kind of kept driving me to further my education and start up women's health programs. And it was just really, honestly, an exciting time for women's health. I really feel like it was the beginning of kind of where it's going now, and I feel really lucky that I got in at that time. It was just amazing. I got to study under some really amazing women like Elizabeth Noble, and I know Carolyn Anthony is still doing some really amazing work. So those were some of the first courses that I took. Other women that were equally as passionate, and it just kind of propelled me.
That's amazing. I love it. So I'm also a women's health or pelvic health physical therapist. So I had my first baby in 1999.
Mhm.
And then in 2000, I saw the course. It was by Herman and Wallace. So it was Holly Herman and Kathy Wallace. And so late 2000, I went to my first course, and it was just life changing, right? Like,
Life
wow.
changing. Yeah.
And imagine where we've come in the last, 19 years. I remember going to physicians' offices, OBs, urologists, and them being like, what's that? So it's amazing, the growth. And not that never happens now, but there's so much more awareness. It's a really, really exciting time for pelvic health.
Yes, I went to Alta Bates Hospital here in Progressive Berkeley, right, where we kind of pride ourselves on being so advanced, and we're at the forefront of everything. And I spoke to a really prominent women's health OBGYN group. This was several years ago, and I remember being kind of nervous, sitting down like, ooh, they have so much experience. And they asked me kind of quizzically, what can a physical therapist do for our patients? And I was just blown away. Like, it was a genuine question. He really didn't know what we can do for his patient population. And I was just like, wow, we still have so much work to do. I'm so glad I'm here to answer that question. And I feel like I am still here answering that question, but now on a platform, like Instagram, where instead of doing one-on-one where we talk to one patient at a time, or maybe 3 to 5 physicians at a time, now we can go on Instagram and give information to hundreds, if not thousands of women at a time.
Powerful. It's a powerful platform. And
So
just
good.
even technologically, where we've gone in the last 20 years, it's amazing. So
Yeah.
the opportunities to connect people with resources. So tell me a little bit about, so Bao Bei Maternity. I'm saying it correctly. Yes?
Close. There is no wrong. Technically, there are several pronunciations of the word, but how we say it here is Bao Bei. So Bao, B-O-W, and Bei, before there was a Bay, right? B-A-E. So Bao Bei.
Okay, good. So tell me a little bit about how you took the jump from being a PT to starting this company, and a little bit about how that happened.
Yeah. Well, it definitely was born in the clinic. I always say that it was born in the clinic, and our clinic happened to be a Pilates studio also. So it was born in the clinic and the Pilates studio, and it really was just based out of need. I just was pretty much primarily seeing obstetric patients at that time. So women who were going through something orthopedically during their pregnancy or postpartum. So I was seeing kind of a high volume of women, and the frustration was real as far as wanting all of those tools to help them through pregnancy and through healing postpartum and not having them. And it was frustrating as a clinician because I could only give them so much, and I knew that there was still some missing pieces, and products were one of them. And I think once I had the idea and I realized the need, and I started to realize that maybe I could do something about it, but was still kind of, letting that idea sit there. I had a patient who had come in, and she had a pretty severe diastasis, and she was newly postpartum, and she came in and sat in the room, and when she sat down, her binder, she was wearing a pretty rigid, tight Velcro binder, just busted open, and she burst into tears. And it was just one of those moments where I couldn't take it anymore. She couldn't take it anymore. And it was one more huge leap forward that I was like, I'm going to do something. I need to do something. I also saw myself potentially sitting on the opposite side where I was the patient. That could easily be any one of us that
Easily.
Yeah, searching out for the right tools, whether it be service-based or product-based, and being so frustrated by the disconnect of either not being able to get it or it not being available. And that was kind of one of the moments where I was like, I have to do something. And I'm fortunate enough to be here in the San Francisco Bay Area, where we have amazing designers. And if you have an idea, this is a pretty good place to be. You can, I don't want to say easily because I don't think most people would.
Don't minimize it.
Right, but this was a great place to be, to turn that idea into a business and a product line. So I just really started aggressively going after it. I'm going to do this, and kind of full steam ahead.
Yes, wonderful. That's amazing. And it looks like you are filling a need for so many people. I haven't personally tried any of your products, but I was reviewing what you had today a little more in depth. And I think I'm going to order, even though, okay, my youngest is 13, but I'm still postpartum, right? And so maybe those leggings look really, really nice and supportive, and it gives you a high waist too, kind of smooths everything out. So
I think, as women, I think we kind of forget that we go through different phases. And sometimes when I meet with groups, we talk about this. Right now, what's wonderful is that the early postpartum group is getting a lot of attention right now. Like, we are educating them, and we are almost hyper-focused on new mothers within, the first 6 months to year postpartum. But I think we have to be careful with that, not to forget all the other phases, right? Postpartum is over. And I've personally, my children are 10 and my daughter just turned 7, and I've kind of hit a slump, and I think it's just kind of a busy business thing, but where my own priority and status for my own women's health and strength has taken a little bit of a dive. So I am actually, just for posture support, because I'm going to be sitting for a majority of my workday today, I do actually have the leggings on. As I just need a little bit of cueing to my core, because I did work out this morning, but I know that for sitting for long periods of time, I could easily fall into some faulty postures, and I really want to maximize what I did for my workout. So for sure, you can wear them at different phases.
So let's dig into those specifically, and then we'll go over some of the other products too. But tell me a little bit about the postpartum recovery leggings. What is special about them? What are some indications for why someone might want to choose them?
Those are a really special product, and I think my frustration is that I cannot keep them in stock, and I get a lot of emails every week about women waiting for the next batch. So my goal is to try to keep them in stock so that the women who want to get them are getting them. But what's so special about them is the way they support the postnatal body and the way that they feel. So I go back to that client who sat down and the binder just kind of busted open, and how that made her feel and what kind of experience that was and how rigid that garment felt. And what I wanted to do with the postnatal recovery leggings was change that experience so that the leggings and that the support were, one, flexible, that the fabric was really breathable and felt very fluid. I consider myself a little bit of a fabric snob. I've been wearing athletic clothes and athleisure and sportswear forever. I've been an athlete since I was in second grade. So I feel like not only an expert in the textiles, but I have sensitive skin, and I just am really in tune with how the garment feels on the body and how the fabric feels. So I wanted to make sure that fabric just felt really fluid. So that when you had it on, you felt better because you had it on, but then after a while you would just forget about it. It would just kind of be this fluid experience. And the most important thing is where the support is. So when you think about the postpartum body, we want to think about the areas of the body that are or were under the most stress and strain, and some of the little micro traumas that happen to the body during pregnancy could sure use a lot of TLC postpartum. So when I was building those, I wanted to really make sure that there was some targeted compression, but in a really comfortable way, to the areas of the body that needed it the most. They really have been a savior to so many women. And I read the reviews and I just really get emotional because, again, I go back to that woman who sat down and had the pretty horrid experience with the binder. And I think what the postnatal recovery leggings have done is really turn that experience around. And then once I was able to do it, I'm in the position now where we also just offer some really fun colors that are trending in activewear. And I think, from a therapeutic support business, people forgot about that. People forgot that women actually care what they're wearing even when they're healing, and that the color Merlot or charcoal can really get someone excited about wearing postnatal support. So I think one of the things also that Bao Bei did was really tap in to what women want in that garment. And I think because I'm still around so many new moms, I'm still teaching, I'm still doing workshops, I'm able to really listen to what they want and then make sure that we incorporate that into the product line. So for, like I said, the postnatal recovery leggings, I think the colors are just an extra special bonus of a product that has already been really well received.
That's awesome. So with the postnatal, it gives you some belly and back support. Tell me a little bit about the support from below.
The most support in the postnatal leggings is going to be that 360-degree hug that wraps around all the way from the back, right arm multifidus, and wraps around the sides and goes to the front. As far as pelvic support, there's a little bit less pelvic support than abdominal support. And what the pelvic support does is within that same fabric, although on a little bit of a lower level, it continues to hug and hold and wrap that part of the body too, because as we know, whether someone's had a C-section or a vaginal delivery, we have to incorporate the pelvis too. So again, the most targeted support is going to be through the core, but we didn't want to forget about the pelvis. And I think also has this really good demonstration of the balloon. What happens if you squeeze the midsection, right? Squeeze the balloon too much. I'm Suzanne. I'm the owner of Bao Bei Maternity. I'm also a women's health physical therapist and a Pilates instructor. So the first question that I got was about the name of the company, and the word Bao Bei is the Chinese word for something precious. I think that it's the perfect name for a company that is supporting women through this most blessed occasion of pregnancy and postpartum. And I just love that it is not so obvious that you have to dig a little deeper to find the name and the meaning. And when you do find the meaning, I think that it's just really beautiful. The next question that I got was what inspired me to start Bao Bei. And as a physical therapist working with a lot of pregnant and postpartum women, I quickly realized that there was a lack of support garments on the market that really did what they were supposed to do, and that they really matched the needs of pregnant and postpartum women, and that they were enjoyable to wear. So I decided to go on a journey to create a product line of therapeutic support meets modern day performance wear. So let's talk about the product line. I have the Pro Bump here, which is the support band for pregnancy, and it can continue to be worn postpartum. It has uniform compression through the front, sides, and back of your body, so it gives you this comprehensive hug and hold, and it helps with the orthopedic ailments that pregnant and postpartum women go through. And it feels amazing because it's breathable and flexible, and it's a fabric that we created for moms to fall in love with. And I think that every mom should have a Pro Bump. I think every mom deserves a Pro Bump, and I'm really proud to offer this product to you guys. So the bloomers are the next level of support, very similar to the Pro Bump, but what the bloomers are going to offer are a beautiful scallop detail at the top, making mom feel really special. And then they're also going to offer additional pelvic floor support. So where the Pro Bump just stops at the bottom of the abdominal area, the bloomers are going to hammock the pelvic floor and give additional support to pregnant and postpartum women. So I've changed my mannequin. As you can see, you can get a visual for how the bloomers are going to hug and hold the entire abdominal area, but they're also going to hammock the pelvic floor area. Okay, I also want to talk about the postnatal recovery leggings, and what I think is important to note about these leggings is that they offer an amazing amount of therapeutic compression that wraps 360 degrees around the midsection, but that we continued some of that support in the pelvic area, because what we know is some support garments of the past were squeezing women's midsections too tightly and pushing pressure down onto the pelvic floor, and we absolutely don't want to do that to the healing and recovering body. So what we did was build the right amount of support into these leggings in the right areas to support a woman's body, and we made it look like a really nice pair of athleisure leggings that mom is going to want to wear. The other thing that I want you ladies to know is I'm pretty sure that Bao Bei is the first company that really made an effort to make support garments look a bit more stylish and feel a bit more luxe. And I hope that you guys appreciate some of the color choices like Merlot leggings and blush bralettes and neutral tones and energizing colors that make you feel like you want to go to the gym. I really put an extra effort into making sure that you guys would not only appreciate the therapeutic benefits, but really feel adored and excited to wear these garments. So enjoy. I'm so proud and grateful to bring these products to you, and thank you for your continued support of this brand.